Welcome again once more in our study series. We are talking about the AWaRe classification of antibiotics by the World Health Organization, and realize that the World Health Organization brought this classification in order to promote appropriate antibiotic use. We also realize that they brought it into play in order to reduce antimicrobial resistance. It also brought this into play in order to improve the patient's outcome. So the classification of these antibiotics was majorly brought into three categories by the WHO, whereby we find that we have what we call the access drugs, we have what we call the watch drugs, and the reserve drugs. So according to WHO, it actually recommends 60% of the country's prescriptions on most of these common conditions should fall into these access drugs. Why does the WHO recommend that most of the prescriptions that are prescribed for common infections should fall under the access drugs? It is because these access drugs are predominantly the first-line antibiotics that are majorly used for all common infections, majorly common bacterial infections in this case. Why does it really choose these ones? The simple characteristics under which WHO decided to recommend these access drugs to be 60% of the prescriptions made is because they are narrow-spectrum antibiotics. That means they work specifically based on the identified microorganism. We also realize that they have a lower resistance potential because of their specificity. So they have a low resistance potential. We also come to understand that the WHO recommended the access drugs to be used 60% in a country's prescription because they are easily affordable. Not only are they affordable, but they are also widely available. To mention but a few examples under the access drugs, we find amoxicillin, ampicillin, doxycycline, nitrofurantoin, metronidazole, Septrin, gentamicin, and others. It is actually many of them down there. When you check through the WHO lineage, you'll get them actually listed in there. So those ones were majorly specified for that major function. Then we also realize that they actually manage the most common infections that affect our communities, which may include maybe the pneumonias, the UTIs that we have, the dental infections, the cellulitis, the strep pharyngitis, and the other infections that are majorly common within our communities. Then we also need to know, what I needed to know with access drugs is always use access antibiotics or access drugs appropriately so that patient care can actually be the center of attraction. Then we continue further and talk about I'm talking about the watch group of antibiotics. The watch group of antibiotics actually has a higher risk of promoting antimicrobial resistance or antibiotic resistance and should only be used for specific indications. Now in this case, realize that the characteristics behind which these watch drugs work is because they are broad spectrum and at the same time they drive a higher potential of promoting antimicrobial resistance and majorly the antibiotic resistance. And they always require close or careful monitoring. Examples of these antibiotics include the ceftriaxone, the fluoroquinolones. You can talk about the second class, the third class of the fluoroquinolones. And of course, we also talk about some, actually, the macrolide class, and they are majorly indicated management of common severe infections, which can involve maybe severe pneumonia, typhoid, meningitis, gonorrhea, complicated UTI, and other infections, including the hospital-acquired infections. And you can find more on the WHO website. Actually, if you click in there, you can find them there. So what I should let you know about these watch drugs is appropriate use of these drugs can actually help in the recovery and improvement of patient care, but unintended use or unnecessary use can actually predispose and actually can drive into antimicrobial resistance. Then after you have understood the watch drugs, let me dive in to let you know that we have what we call the reserve drugs, which is the last group. They are always marked with the red coding. So these reserve drugs are actually the last line of antibiotics used in confirmed or suspected multi-drug resistance organisms, or infections. So you need to realize that these characteristics of these drugs include they are always the last resort in the line of antibiotic use. Then they are also used in specialized settings. They are also reserved for life-threatening conditions, and those monitoring, they actually monitored closely through antimicrobial stewardship. So they need close monitoring through antimicrobial stewardship. And it involves examples like the polymyxin E and the linezolid and others when you check through the WHO website. So just to let you know, I want to give you, so in summary, this AWaRe classification of antibiotics was introduced in order to promote a rational antibiotic use or prescription, also to reduce antimicrobial resistance, to improve on the patient's care, support antibiotic stewardship programs, and to help preserve the antibiotics for the future generations. Then we also realize that the key message that you have to master in all this description I've given you is access drugs are used for common infections and with the help of commonly available drugs. Then, of course, we're also looking at the watch drugs are used majorly and unconsciously when indicated majorly. Then we see that these reserved drugs are given majorly on multi-drug resistant organisms or infections. Then the key message I want you to know is avoid self-medication and unnecessary antibiotic use. As a client or as a member or as a patient, always avoid self-medication and unnecessary antibiotic use. Then another message I want you to understand is this message applies to the clinicians, the doctors, and those that are involved in the clinical room. Always prescribe antibiotic based on the clinical guidelines, and where possible, perform culture and sensitivity in order to guide treatment in this case. So I want to let you know that thank you for following. Thank you for being a part of the member of the Global Health Science Study Series. For today, if you found this lesson so helpful, please like, share, and subscribe. Turn on your notification button and turn on that bell so that you will be notified every time we release another medical lecture like this. So always stay informed, stay safe, and always use antibiotics responsibly. Thank you.